Hi, I'm Nicole wURKEN, Research Director for Mad Money, and I'm here with Russ Kenneth wURKEN, Personal Finance Editor at The Street. Welcome back to What's Workin', where we're highlighting young innovators each week. Now, today we have Russ Graney. Welcome, Russ.
Thank you so much, Nicole.
Thanks for coming. He's the co-founder and CEO of Aidin, which helps connect patients in hospitals to post-acute facilities like nursing homes and beyond. So tell us, Russ, what is your company? Why is it important? And why are you so passionate about what you do?
Yeah, so Aidin is a healthcare technology solution for hospitals to use that helps them get patients from the hospital bed into the continuing care that they need post-discharge. So increasingly, patients actually receive a lot of healthcare after a hospital visit, either in their home, being visited by visiting nurses or visiting therapists, or going to another facility like a skilled nursing home or an inpatient rehab facility. And we help hospitals kind of make that transition for their patient from the hospital bed into that post-acute setting.
And in particular, you've mentioned that going through some of this on a personal level inspired you to found the company. What kind of experience did you have, and why did you see that there was this need?
Yeah, so I mean, just prior to founding Aidin, I was actually working in private equity, and one of my investments was in this space. So I learned quite a bit about the world of post-acute care, as it's called. But really what was the call to arms, if you will, was going through this experience personally with my uncle. My uncle had early onset Alzheimer's, and in the last couple of months was constantly in and out of the hospital, to a nursing home, to home. And going through that experience with him and my aunt in the hospital bed, and understanding just how few resources there were available to patients, and how much time and energy it took hospital staff to discharge a single patient was really alarming, and was really what led me to join up with my founding team to build what's eventually become Aidin.
Now, Russ, what's so fascinating to me is that you've applied the skills from consulting at Bain and private equity, and you were also you ran a charter school that you founded. I'm curious, how have you applied those skills to medical technology?
Yeah, I think that the opportunity to build Aidin has brought in a lot of my previous experiences. My work at Bain and in private equity was really tantamount to understanding the industry and making sure that we're building a solution that really fits into the current ecosystem. So we actually work with hospitals, we also help these post-acute providers, and then finally, and really importantly, we interact with patients. So being able to build a tool that fits all of those people's business needs was really important, and something that work at Bain and private equity was very helpful with. And then obviously, I had this amazing opportunity to found and run a charter school out in Bed-Stuy, Brooklyn. And doing that was amazing, not only for the impact that it had on me and hopefully on the community there, but also the experience of building something from the ground up is a really unique experience. And I think ultimately doing that was what got me hooked on entrepreneurialism. And so that's really what got me into this world and excited when the opportunity for Aidin came up.
It's really interesting. When we think about entrepreneurs, we often think about the tech sector. And interestingly, you've talked about Aidin actually being not only a healthcare company, but a technology company that simplifies a very complex system. What does that mean?
Yeah, so I think healthcare technology, as a lot of us know and probably experience on a day-to-day level at the doctor's office or in hospitals, there's a lot of room for improvement in technology, and a lot of the advances that we've seen in the world of consumer technology haven't really fully been applied to healthcare yet. So our approach is, we have deep healthcare industry knowledge and experience, and you need that to understand the complexity of the workflows and the different incentives that all these players have. But what we're also doing is bringing in the approach that consumer tech has, which is very design-focused, very user-focused, to make sure that we're actually taking all of that complexity that you see and presenting it in a very simple and clear path for our users to follow, which has ultimately allowed us to create a tool that doesn't require any training, that is ready to go out of the box, so to speak.
The recent Time Magazine Brill piece, the 25,000-word opus, really hit home the idea of how expensive healthcare is in this country. Do you think your technology solutions can help with cost cutting?
Absolutely. I think there's a lot of change going on in the healthcare industry right now. And there's one big new thing that's really related to what we do, which is around readmission rates. So all of a sudden, hospitals are now responsible for how frequently their patients end up back in the hospital within 30 days. And that change has really opened up a lot of opportunity for companies like ours, which help ensure that patients after they leave the hospital get quality care beyond their stay. And so what that has done is really given us an opportunity to build upon that incentive to help hospitals save money there and improve the patient experience all at the same time.
Got it. So when a hospital wants to discharge a patient after a week, they have to think twice to say, is that patient going to come back? And they want to go to a company like Aidin to make sure that they have the right, they're putting that patient in the right place after whatever treatment.
Precisely. You know, in the past, hospitals really were focused pretty much exclusively on length of stay, getting patients in and out quickly and effectively. And now they need to do that, but they also need to make sure that when they do get that patient out of the bed, they're going to a really high quality follow-up provider. And our tool really helps them with both. We've cleaned up a workflow that today is very cumbersome, can take anywhere from 30 to 90 minutes to discharge a single patient. So we've actually taken all of that administrative work, simplified it down to 3 clicks, and at the same time incorporated quality reviews and ratings of post-acute providers and incentivized patients to use that information when they're choosing where to go, thereby ensuring that patients get better care and that hospitals have a stronger network of post-acute support to rely on.
Really amazing. And quickly, how you make money. You were mentioning, obviously, there are some advantages now after the Affordable Care Act that now your tool is even more necessary than before. Are you charging hospitals? Are you charging the acute care facilities? Who are you charging?
Yeah, so our revenue model is based on hospitals. They pay us a subscription fee for access to our services. And that's really because most of the benefits in the short term are really unlocked by hospitals, and that reduced length of stay, managing their readmission risk, and also engaging patients, which is actually a huge part of CEO compensation, is a survey on how satisfied patients were with their hospital stay. So that's another huge impact with it that we're able to participate in and make sure that patients have a smooth discharge so that their experience is actually better than the one that I had with my uncle.
It's very much socializing, almost like a social network, the hospital experience. I think it's fascinating.
Yeah. Well, thank you, Russ, for being with us. A really exciting company. This is Aidin. You can check it out, www.myaidin.com for more information. This is obviously an issue that touches many people on a personal level and is an important initiative. Russ Graney, thanks for having us. Welcome back to What's Workin'. I'm Nicole Urkin with Ross Urkin and Russ. Thanks.